this segment, I'd like to go over placental graft matrix, or PGM, and how we use it in regenerative medicine. Placental graft matrix, like the name implies, is a tissue that's taken from the placenta. The placenta, as you know, is when a baby's born. It's the sac that forms around the baby, keeps it safe and provides nutrients. And they often call it the afterbirth. After the baby's born, they take the placenta, and in every hospital, I didn't realize this, there's a special team that gets rid of the placenta, but in most cases, it's not medical waste. The placenta has a lot of applications in medicine, because if you think about it, what grows faster than a baby? It is full of growth factors, it's full of nutrients, and if you've seen other segments that we've discussed here, it has amazing properties. It's been in use in medicine for over 100 years. They use it for burn victims, they've used it for non-healing like foot ulcers, and they've even used it now, we're finding, in regenerative medicine for damage to your musculoskeletal tissues like ligaments and tendons and small joints. It tends to break up scar tissue, so it's antifibrotic in nature. It is very good at killing germs. They've used it, for example, on open burn victims who have open wounds. It tends to keep the moisture in, kill the germs, and let the tissue heal. It also has wonderful regenerative properties. So people ask, when do I use PGM? When is that useful? Well, the nice thing about the placental graft matrix product that we use is comes to us in what looks like a powder form. It's desiccated or dried out, and they morselize. They cut it up, and it sits on a shelf. So it's good for up to 5 years. So it's literally like taking a bunch of what looks like chalk, and all you basically do is reconstitute it. You take a little bit of lidocaine, numbing medication. You can use saline or just normal, fluid, but I like the lidocaine because it also gives you the benefit of numbing you up as you're poking somebody. Most people appreciate that. And you dilute it down to a certain point, depending on how big the joint is. A good example would be someone who has a tear in one of the rotator cuffs in their shoulder. A case example I was given was a guy who was a 42-year-old drummer. And he'd been a drummer in a rock band for years, and like a lot of drummers, he'd get shoulder problems after that, after 20, 25 years of banging on the drums. And he had pain in his shoulder that would not go away, and the MRI showed he had a very discrete tear where that tendon attached to the bone when he lifted his arm. Well, he tried 8 months of physical therapy, rest, steroid injection, dry needling, you name it, he tried it, didn't work. 8 months later, it looked almost exactly the same. He did a PGM injection in that area under ultrasound guidance, and 3 months later, they showed a picture of side of his shoulder, an MRI, from month 8 to month 11, and it almost completely healed. He said his pain was all but gone. So it's very, very good for soft tissue injuries. A good example would be a rotator cuff tear, plantar fasciitis. People who've had that chronic runners get this pain in their bottom of their foot that will not go away. We're not talking about a couple weeks. A lot of us get it and it goes away, but 6 months, a year later, you still can't run. And it's driving you nuts because you love to run or you love to play basketball, and an ultrasound or an MRI shows this area where it just doesn't look normal there. Well, it's, a little PGM might work extremely well there. It's also be extremely good for small joints. Like, this is a very common place for typically people who are middle-aged to get pain, base of the thumb, here, big toe problems. How does it work? PGM is full of growth factors. The same growth factors that help a child grow will actually help recruit new tissue to be laid down and basically put in new collagen fibers. Again, collagen is that protein, that semi-elastic protein that does this in your skin, but also provides strength and stability in your joints. So if you have a question as to whether PGM might be right for you, please contact us. We'll let you know if that's an appropriate treatment plan. And if so, it's a very simple and easy way. It's very simple to apply and to use, and typically the results are quite good.